Okay, let's talk about acute disseminated encephalomyelitis, abbreviated as ADEM. Now, ADEM is very similar in some ways to multiple sclerosis, which is a demyelinating disease, but usually ADEM has some distinguishing features. One of them, as is important, is it is a monophasic acute inflammation and demyelination of the white matter, and usually it is related to a viral infection or vaccination. But is very similar in the radiological features to multiple sclerosis, namely involving the brain, the periventricular area, and the brainstem, the spinal cord. It can also cause optic neuritis, but ADEM is usually monophasic. If it becomes a polyphasic, sometimes it is defined as, or it is multiple sclerosis that was thought to be ADEM. Now, there is a variation to ADEM, which is called a Hurst variant, which we will talk about, which is a much more fulminant form of ADEM. Now, ADEM is more systemic than multiple sclerosis. I mean, there are systemic illness, usually, again, viral infection or something, and as you can see, rather than focal, ADEM is rather than focal, it has a more systemic manifestation like seizure, multifocal neurological symptoms, and this is it. Now, in the radiological feature is quite similar to multiple sclerosis. You can see there are the ring enhancement lesions with open ring, like in multiple sclerosis. There are hyperintense lesions around the periventricular area, and this is why it is very similar to multiple sclerosis. Now, sometimes it's very disseminated, such that it can cause the Hurst variant, and in Hurst variant it can even hemorrhage and cause hemorrhagic leukoencephalitis, and when it is a Hurst variant, it's usually fulminant and cause death in some days. Now, usually after ADEM attack, usually most patients, most children, because this is usually in children, recover. Sometimes there are residual neurological sequentials, but usually patients recover. And this is it. You can see the open ring enhancement, the hyperintense lesion, as in multiple sclerosis. Thank you very much. This was about acute disseminated encephalomyelitis, ADEM, and that's it.